Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. You know, as healthcare changes, it's important that our hospital facilities keep pace with the community needs. Our planning efforts show that we need to improve access to care, bringing specialty clinics back into our community, and enhancing the efficiency across our campus. I'm so fortunate today to have with me Tyson Moulton, our Director of Facilities. He's going to talk about the plans to update the hospital campus that will match the future needs of healthcare. So Tyson, thank you so much for being here. I know you've been here before, so you're comfortable at this, but it's great to have you back because there's so much happening.
Well, thanks for having me.
Yeah, so we're going to jump into it because I know there's a buzz about the communities, about what's happening at the campus. And so maybe you could just give us a little overview when you hear the words master facility plan, what's happening at Northwestern Medical Center?
Yeah, absolutely. So the master facility plan, as we talk about it, really consists of three projects. The first is an addition to the med-surg unit, and that is right here on campus. That also includes a renovation to the existing med-surg unit, and that will transform our hospital to 34 private beds, and this will be getting us away from the semi-private rooms entirely. The second part of the project is a new building, or a new addition to the building up at the front of campus that will include medical clinics. So this will be for OBGYN to bring them into the hospital. It'll also be a new home for cardiology and pulmonology, roughly where they sit today, and a space for those specialty clinics that you mentioned were so important to getting back to the community. So a flexible space that will allow those specialty providers to come in for whatever the need is, you know, whether it's 2 days a month or 1 day a week or whatever it is. The third piece will be a 2-story medical office building that will be attached to the hospital. This will allow us to bring orthopedics, primary care, and urgent care into a building that is physically connected to the rest of the hospital, as well as bringing those services that are core to our mission, primary care and urgent care, right to the front of the campus rather than kind of being in the back with cobblestone. And that'll be a 2-story building. Those services will be on the first floor. The second floor will be shelved for future expansion. So that's basically the master facility plan in a nutshell.
Wonderful. And just for our viewers, this is our front door right here where folks are accustomed coming in, and that will remain our front door,
that's
correct?
Yes, that's correct.
We might have a second front door, so to speak, with other services. So this is right at the front door. So what is this going to look like when we start construction? And by the way, when do you anticipate that this might all start? And then how is this going to phase through?
Sure. Well, the short answer on when is as soon as possible. The long answer.
We're ready to go.
Yeah, exactly. The long answer is that we're still in the permitting phase. So we're still waiting for some permits. And some of those don't have, their time frame's a little bit squishy. So we're really hoping for an April 15th groundbreaking. Realistically, that could go into May. And so it really just depends on how fast we get through the bidding process and if we have any complications with our remaining permits. As far as impacts, there are going to be impacts to the campus. Obviously, anytime you do major construction, there are impacts to access and to traffic flows and things like that. So the impacts, first of all, to build the med-surg ICU, we're going to have to move this road. So the road currently comes through about like this.
And we just added some things here too, right? So
yes. So last year we took Crest Road, which used to run about here, and moved it 90 feet to the east. With that project, we were able to expand our parking. So we were able to add about 200 parking spaces to our campus, as well as create some additional space to get parking closer to the main entrance, parking for a conference center, which was really
Definitely.
needed, and creating the space for the medical office building to be sited.
So that's probably
where it is.
helpful in when you start moving this back, because this
Absolutely.
goes into parking, right?
Right, absolutely. This is currently our third shift parking here, and then some additional employee parking here. We are expanding parking along Crest Road over towards the emergency department, and back at Cobblestone, and over here in this field south of the Northwestern Counseling and Support Services building.
Okay.
So that will happen first thing. It's not going to affect traffic all that much. It will affect parking for employees, and that'll be where most of the disruption is. The next impacts that we'll see are part of this project, the medical clinics project, is a renovation to our lobby. So as we're renovating the lobby, we will have to close the main entrance. And our main entrance will be temporarily moved to the conference center. So we're going to try to minimize that as much as possible, but it is probably going to be about a 4-month disruption. We also have to do work to the grading of our access drive, the more westerly access closer to the city. Will be closed for approximately 4 months as well. So all access to campus will come in through the Crest Road entrance. Those are the main, the kind of big ticket impacts that the general public will see in our campus.
So when I think about that, I mean, our ambulances come in through here and go out here, and of course this is our front entrance.
Yes.
So you're saying folks will come up through Crest Road, and good thing we have this new parking.
Absolutely.
That the main entrance will be through here. Now ambulances will go around this way.
That's correct, yes.
To get to the emergency department. And then when you're moving this road back, I know urgent care is back here too. And of course, we're trying to, if folks don't have a true emergency but need to be seen when their primary care is not available, we're encouraging folks to go to an urgent care
That's right.
versus the emergency department. So will they still be able to get to the urgent care?
Absolutely,
Okay.
yeah. So we will keep access to that Cobblestone building. Obviously, they're open every day of the week.
Right.
So we need to keep access to that service at all times. There may be some minor disruptions going down to one-lane road or something like that. Those kind of micro disruptions, we're not really clear exactly on what they are, what the timing is, but we will keep that open to access at all times.
So will there be, it sounds like we're going to move the road back and we're going to start with this addition here. Are we going to have 3 things going on at the same time? And
Yeah, let's talk a little bit about the overall phasing and
Yeah,
how
that'd be great.
these projects overlap. So we are looking at doing the med-surg addition first. And once we get through some of the site work and some of the site disruption in moving the loop road, we'll then move to the front of campus and start on our lobby renovation. The thought process behind that is one, let's keep the site disruption as limited as possible. So let's get through the site work in the back of the campus before we really start on the site work in the front of campus. The other piece is, as part of the renovation in the front of the hospital, we're going to have to close down access, as I mentioned. So that means, as you mentioned, ambulance traffic will have to come in through Crest Road and around the back of the building. And so that piece of the project has to be complete before we can start at the front of campus. So there will be overlap between the construction on med-surg and the construction of the medical clinics and medical office building. The rough schedules, we're looking at a May start on the med-surg edition, and then we're looking at a July start on the medical clinics and medical office building. The medical clinics will continue through March of 2017, and the medical office building through May of 2017. And we'll still be working at that point on the renovations in med-surg, which will continue to about September of 2017.
Okay, so map that out. So how long is this project?
This project is roughly 18 months.
Okay.
And so we will have concurrent construction at the back of the campus and at the front of the campus. And we really did that. We had a choice whether we wanted to limit impact and draw the project out, or understand that we were going to have some additional impacts by doing the projects concurrently, but we'll be greatly condensing the project into that relatively short 18-month period.
Wow. So, what's the cost of this project?
So the overall cost of the project is just south of $32 million, and that includes the construction as well as all of the furnishings and the equipment that we need to purchase, as well as design and permitting and all those other administrative fees. So that's the total project cost. The construction cost, we're anticipating it being about $23 million for all three projects. We'll know more once we get through the bidding process. That's really where the rubber meets the road. But all of our estimates have been in that neighborhood.
So will you be managing this project?
Yes.
It sounds like I can't imagine being over all of that. I mean, I know I'm over the hospital, but all of the things that you have to be so responsible for.
Well, I will be managing this project. This will be my only project during the time period. But we have a great construction manager on board in PC Construction. They have a lot of familiarity with this type of building. They work in hospitals all the time. They have been a great partner in helping us through the planning process for construction. So I'm certainly not going it alone. We have a great team behind me that'll be helping through all of the pain points in this project.
So what's your background that you seem so comfortable with this project?
Well, I have a master's degree in construction management from Arizona State University, and I also spent, before I was at Northwestern, I was director of facilities at Gifford Medical Center down in Randolph, and then I've been here for about a year and a half, managing construction projects, and my whole time here has been spent talking about this project. So I've spent a lot of time looking at this picture and thinking about these issues. So it hasn't been an immediate thing, but I've certainly spent a lot of time on it.
So thank you. So how are we going to keep the community up to date on this? I mean, what's our plan for communication both internally and externally? Because this is going to be disruptive, and we still want people to come, as they've been coming now. And so how are we going to keep the flow of things and the communication?
Well, we're working with Jonathan Billings and the community relations team on a communication plan. And that's really identifying who our stakeholder groups are. So our internal staff, as well as how we're keeping the community involved, and starting to look at what the mediums are where we can really get the information that we need to the community and more directly to our patients that are coming here for care. And so we're looking at, or we'll be doing a newsletter that will really inform our internal customers and some of the folks in Doctor's Office Commons and some of our neighbors. And we're still looking at how we're going to keep the community informed. We're obviously going to use our webpage, as well as using scripting for those individuals who are coming here for appointments, so that when they're making their appointment, the person on the other end of the phone is saying what the changes will be. Here's what might be different from the last time you were here, and so that they can be aware of what they're coming into when they get on campus. We'll also utilize the St. Albans Messenger and social media as much as we can. That plan is still really in development, but we understand the importance of making sure that everyone understands what's going on, and more importantly, just what the impacts are. How do people, if this entrance is closed, how do people get access to the emergency department?
Right.
And making sure that it's clear, even if you haven't seen social media, even if you haven't seen the article in the Messenger or whatever it is. And so one of our key communication tools is really signage on campus. So making sure that we have clear signage that shows people where to go, and so that there's no question, because it is going to be a little confusing since people are, I think that this has been the front entrance since 1949 when the hospital was built.
It's pretty programmed in.
Exactly.
So that's terrific. I wish we had more time, and I can tell that we're going to have you back again because this is an exciting project, and the community is definitely wants to be in the know on this. We want to make sure that we're good partners with the community and we keep folks really well informed. So thank you so much for giving us at least a snippet of what's about to come. So
well,
thank you very much.
Thanks for having me. It's my pleasure.
Yeah, thank you. So this is Jill Berry Bowen, CEO of Northwestern Medical Center, and I can tell you there's a lot of things going to be happening soon on our campus to improve access to healthcare and ready us for the future of change in the delivery system. As we roll this out, there's going to be opportunities. I'm sure you'd love to be a part of it, and we're going to communicate not only about what's happening, but about if there's any philanthropic opportunities for you to become a part. So stay tuned. There'll be more to come, and keep watch of that campus on Fairfield Street because it's going to change, and it's going to be, once we get started, sounds like about 18 months. So it's exciting times. Thank you for joining.